What I'm about to share with you in the next few minutes could literally change the trajectory of your cardiovascular health. And I say that carefully, because after 30 years in cardiology, I've learned never to promise what science can't back up. But what you're going to hear today is different. This is the kind of information I share with my closest patients, behind closed doors, in my office. Information that most people never receive because doctors assume they won't act on it. Well, I think differently. I believe you deserve to know the truth. Every single day, millions of Americans wake up with arteries that are quietly working against them. They don't know it. They might feel a little tired. Maybe their neck feels stiff in the morning. Maybe their blood pressure has been a little high for a few years, but they think it's not urgent yet. And meanwhile, silently, inside their blood vessels, something is building. Something dangerous. Something that, if left unchecked, can lead to a heart attack, a stroke, or heart failure. And the tragedy is that in the vast majority of cases, this process could have been slowed down, even stopped, with something as simple as a tiny seed. I know that might sound too good to be true. I understand the skepticism completely. Early in my own career, I would have raised an eyebrow if someone had told me that a seed could have a meaningful impact on arterial health. We're trained to prescribe medications, read echocardiograms, plan interventional procedures. Nobody talks much about seeds in medical school. But medicine evolves, and the scientific data accumulated over decades eventually imposes its truth, even on the most resistant minds. And that truth is what I'm sharing with you today, fully and without filters. Let me briefly establish who I am, not to boast, but so you understand where this information is coming from. I've spent 3 decades treating patients with cardiovascular disease. Hypertensive patients, diabetics with severely damaged arteries, patients rushed into the emergency room clutching their chests, unable to breathe. I've watched people lose years of their lives to atherosclerotic plaque that nobody had ever taken the time to properly explain to them. And I've also seen patients who, after understanding what was happening inside their arteries and making certain dietary changes, achieved results that surprised even their own primary care physicians. Those repeated observations, across thousands of cases, led me to dig deeper into cardiovascular nutrition. I've read hundreds of studies, attended international cardiology conferences, collaborated with researchers in endocrinology, immunology, and vascular biology. And gradually, I began to understand that what happens inside our arteries is not a genetic destiny for the vast majority of people. It is largely a reflection of what we eat, how we live, and what we put into our bodies every single day. So, let's talk about your arteries. Let's talk about what's actually happening inside them, because most people have never visualized this process, and that's precisely why they don't take it seriously enough. Imagine a flexible, elastic tube capable of expanding and contracting with every beat of your heart. Your arteries, in their optimal state, work exactly like that. The inside of the arterial wall is lined with a thin layer of cells called the endothelium. These cells play an extraordinary role. They regulate blood pressure, control the flow of nutrients, and prevent unwanted substances from penetrating the vessel wall. It's an intelligent, dynamic, living barrier. But when the diet is chronically imbalanced, when persistent stress settles in, when blood sugar stays elevated for too long, when harmful fats accumulate in the bloodstream, something begins to deteriorate. The endothelial cells become inflamed. Micro-injuries appear along the arterial wall, and at those vulnerable points the body sends what it believes is a repair response. Macrophages, immune cells that absorb oxidized LDL, the so-called bad cholesterol, and transform into what we call foam cells. These foam cells accumulate within the arterial wall, forming a fatty streak, which then grows, calcifies, and hardens. We call this atherosclerotic plaque. Now picture that plaque thickening progressively. The space inside the artery narrows. Blood has an increasingly difficult time flowing through. The heart must pump harder to maintain adequate pressure. And that is precisely where blood pressure starts to climb. This is not coincidence. Hypertension, in the majority of cases, is directly tied to the condition of your arteries. When they're rigid, partially blocked, and chronically inflamed, pressure rises. And when pressure rises, the arterial walls face even greater mechanical stress, which promotes new injuries, which promotes new plaque. It's a brutal, silent, self-reinforcing cycle. What makes this situation particularly dangerous for Americans is that for years, sometimes decades, atherosclerosis produces absolutely no symptoms. It advances in the shadows. A patient can have a coronary artery 60% blocked and feel perfectly fine during their daily routine. Then one morning, after physical exertion, after a sleepless night, after an emotionally devastating event, a plaque ruptures. A clot forms instantly. The artery occludes completely. The heart muscle stops receiving blood. That's a heart attack. Or that plaque fragment travels to the brain. That's a stroke. All of this preceded by complete silence, no warning signs whatsoever. This is why I call it the silent danger. This is why I still spend significant time explaining to my patients what's happening inside their vessels long before any symptoms ever appear. Because prevention is where everything is decided. Not in the recovery room after a bypass surgery. Not in the cardiac ICU after a stroke. Prevention happens in everyday choices, in what you put on your plate, in what you decide to learn about your own body. And many Americans have begun to understand that certain things need to be avoided. Cutting back on saturated fat, reducing sodium, limiting refined sugars. That's important, and I commend it. But what's almost never mentioned is that diet doesn't only play a negative role in cardiovascular health. Certain foods, certain natural compounds, have an active capacity to protect the arteries, reduce inflammation, improve vascular elasticity, and help the body manage cholesterol more efficiently. This isn't pseudoscience, it isn't alternative medicine. It's biochemistry, documented, published, and reproduced in laboratories and clinical trials across the globe. And among all the foods studied from this angle, certain seeds stand out in a particularly remarkable way. Seeds that concentrate within them bioactive compounds whose effects on the cardiovascular system have been measured, quantified, and confirmed by dozens of independent studies. Seeds that you could find in virtually any American grocery store, often for just a few dollars, sitting on shelves while people spend fortunes on questionable supplements or miracle products backed by zero credible evidence. Before I reveal which seed stands above all the others, I want to pause for a moment, because what I'm sharing here is genuinely important, and I want to make sure you can keep receiving this type of information. If you're watching this video and you haven't subscribed to this channel yet, I'm sincerely inviting you to do that right now. Hit the subscribe button and turn on the bell notification so you don't miss anything. Every week we publish content grounded in real, validated medical data, designed to help you make better decisions for your cardiovascular health. And I'd love for you to drop a comment below. Tell me what city or state you're watching from, or if you're joining us from another country, let me know where. I'm always moved by how profoundly concerns about heart health connect people from completely different backgrounds, all sharing the same conviction that their health deserves real attention. So tell me where you are, and let's keep going together. Now, back to the science, because what I'm about to explain is something I wish had been presented to me this clearly when I was a medical student. Research on seeds and cardiovascular health has accelerated significantly since the 1990s. Teams of researchers across the United States, Europe, Canada, and Japan began analyzing in depth the biochemical composition of specific seeds and their effects on precise markers of vascular health: LDL cholesterol, HDL cholesterol, triglycerides, C-reactive protein, which is a marker of systemic inflammation, systolic and diastolic blood pressure, and arterial stiffness. What emerges from this research is striking. Certain seeds contain extraordinary concentrations of multiple bioactive compounds that act synergistically on the cardiovascular system. We're not talking about a single nutrient that does a little something. We're talking about a unique combination that acts on several fronts simultaneously, reducing inflammation, improving the lipid profile, protecting the endothelium, and modulating blood pressure. Soluble fiber, for example, plays a role in cardiovascular health that most Americans are completely unaware of. When you consume soluble fiber, it forms a viscous gel inside your intestine. This gel literally traps a portion of dietary cholesterol and bile acids before they can be reabsorbed by the body. The liver, which needs bile acids to function, then draws on its cholesterol reserves to produce more of them. The result? LDL levels in the blood drop. This is not a theory. It's a documented physiological mechanism, actually the basis for how certain cholesterol-lowering medications work. Then there are the essential fatty acids, particularly omega-3s. Americans hear a lot about omega-3s from fatty fish like salmon and mackerel. But there are also plant-based omega-3s, specifically alpha-linolenic acid, or ALA, which plays an important role in reducing vascular inflammation. These fatty acids participate in the synthesis of anti-inflammatory molecules in the body, help maintain the fluidity of cell membranes, including those lining your arteries, and have documented effects on blood pressure regulation. And then there's a third group of compounds, less known to the general public but extensively studied by researchers in preventive cardiology. Lignans. Lignans are phytochemicals present in certain seeds at very high concentrations. These molecules have powerful antioxidant properties, meaning they help neutralize free radicals that attack arterial walls and contribute to LDL cholesterol oxidation, a key step in the formation of atherosclerotic plaque. Studies have shown that lignans can inhibit certain inflammatory processes involved in atherosclerosis, and multiple works suggest a positive effect on blood pressure in hypertensive patients. This triple mechanism, soluble fiber, essential fatty acids, lignans, is precisely why certain seeds stand out so clearly in the cardiovascular scientific literature. It's not an isolated effect on a single parameter. It's a coordinated action targeting several of the most important factors in the development and progression of atherosclerosis. Now, let me bring in the clinical observations, because laboratory studies are important, but what truly convinced me is what I've witnessed over the years in my practice with real patients looking at their own lab results. I've had patients who, after consistently incorporating certain seeds into their diet for several months, came back with improved lipid panels. Not dramatically transformed overnight, because nutrition isn't magic, but measurably and sustainably improved. Patients whose LDL had modestly declined, whose C-reactive protein was trending downward, whose blood pressure was overall more stable throughout the day. These clinical observations aligned perfectly with what the research documents. A meta-analysis published in the Journal of Nutrition, pooling results from multiple randomized controlled trials, showed that regular consumption of certain seeds was associated with a significant reduction in LDL cholesterol and an improvement in the LDL to HDL ratio, which is one of the best predictors of cardiovascular risk. Another study published in Hypertension, one of the most respected journals in the field, showed that regular consumption of specific seeds over 6 months was associated with a significant reduction in both systolic and diastolic blood pressure in hypertensive patients. And now let me tell you about the seed that, among all those I have studied, truly stands apart by the richness and convergence of the available scientific evidence. The seed that concentrates within itself soluble fiber, plant-based omega-3s, and lignans in exceptional quantities. The seed whose cardiovascular effects have been validated by dozens of independent studies. The seed I personally recommend to many of my own patients as part of a balanced diet and appropriate medical follow-up. That seed is the flaxseed. Flaxseed, or Linum usitatissimum for the botanically inclined, is arguably one of the most extensively studied seeds in the world in the context of cardiovascular health. and yet it remains dramatically underused, underappreciated, often relegated to the health food aisle without most shoppers truly understanding what it contains and what it can do for their arteries. Flaxseed is one of the richest plant-based sources of alpha-linolenic acid, the plant-derived omega-3. 100 grams of flax seeds contain approximately 22 grams of ALA, making it an exceptional nutritional source for those who want to increase their omega-3 intake without necessarily eating fish at every meal. This fatty acid, once metabolized by the body, contributes to modulating inflammatory processes involved in atherosclerosis, maintaining the fluidity of vascular cell membranes, and positively influencing blood pressure parameters. But what makes flaxseed truly unique is its lignin concentration. Among all foods analyzed to date, flaxseed is by far the richest source of plant lignins. It contains up to 800 times more lignins than most other plant-based foods. These lignins, once ingested, are converted by the gut microbiome into enterolignins, biologically active molecules that exert measurable antioxidant and anti-inflammatory effects in vascular tissue. Studies have shown that enterolignins can inhibit lipid peroxidation, the oxidation of fats in the bloodstream, a process directly implicated in atherosclerotic plaque formation. And then there's the fiber content. Flaxseed contains both soluble and insoluble fiber, in proportions particularly favorable for digestive and cardiovascular health. The soluble fiber creates that intestinal gel that captures cholesterol and bile acids. The insoluble fiber promotes healthy transit, reduces the contact time between potentially harmful substances and the intestinal wall, and helps nourish the gut microbiome, which we now know plays a significant role in regulating systemic inflammation. A study published in the Journal of Nutrition and Metabolism followed hypertensive patients consuming flaxseed regularly over several weeks. Results showed a measurable reduction in systolic blood pressure, the peak pressure during cardiac contractions, along with improvements in their lipid profile. Additional research published in the American Journal of Clinical Nutrition confirmed positive effects on LDL cholesterol, with a statistically significant reduction in participants who consumed ground flaxseed consistently over several weeks. One critically important technical point I need to share with you: to fully benefit from the properties of flaxseed, you need to consume it ground, not whole. Whole flax seeds often pass through the digestive tract without their nutrients being properly absorbed, because the tough outer shell prevents digestive enzymes from accessing the bioactive compounds inside. Ground flaxseed, on the other hand, releases its omega-3s, lignins, and soluble fiber optimally during digestion. You can grind whole seeds yourself in a coffee grinder or purchase pre-ground flaxseed meal directly. Storage matters too. The fatty acids in flaxseed are sensitive to oxidation, so store your ground flaxseed in an airtight container in the refrigerator and use it within a few weeks of grinding. The question every single one of my patients then asks is, how much? And that's an excellent question, because in the world of nutrition, the dose makes all the difference. The most robust studies on the cardiovascular effects of flaxseed have generally used doses between 15 and 30 grams per day, approximately 1 to 3 tablespoons of ground flaxseed. That's a perfectly manageable amount to incorporate into a normal American diet. You can sprinkle ground flaxseed over your morning yogurt, blend it into a smoothie, stir it into oatmeal, toss it into a salad, or mix it into homemade bread or muffin batter. The flavor is mild, slightly nutty, and pairs well with a wide range of everyday foods. I also want to be very clear about something. Flaxseed should not be seen as a miracle cure that replaces appropriate medical care. If you have diagnosed hypertension, if you're taking medications for cholesterol or blood pressure, continue your treatment and consult your doctor before changing anything. What I'm sharing here is complementary nutritional prevention, not an alternative to medical care. Flaxseed is a powerful tool within a comprehensive cardiovascular health strategy, but it works in synergy with a balanced diet, regular physical activity, stress management, and serious medical follow-up. Another dimension I find fascinating in the research on flaxseed is its potential effect on arterial elasticity. Recent work has explored how the plant-based omega-3s and lignans in flaxseed may influence arterial stiffness, a parameter increasingly used in preventive cardiology to assess vascular aging. Arterial stiffness naturally increases with age, but it's also heavily influenced by diet and cardiovascular risk factors. More elastic arteries mean better adaptation to pressure fluctuations, less workload on the heart, and a reduced risk of cardiovascular events. Certain studies suggest that flaxseed's compounds may help preserve this vascular elasticity, partly through their anti-inflammatory effects on the endothelium. I also think about the role of the gut microbiome, whose importance in cardiovascular health we are understanding more deeply every year. We now know that certain intestinal bacteria produce metabolites that directly influence blood pressure, inflammation, and even cholesterol metabolism. Flaxseed, through its richness in prebiotic fibers and through the gut microbiome's transformation of its lignans, enters into direct interaction with this bacterial ecosystem. Nurturing a healthy microbiome is also taking care of your arteries. This connection would have seemed far-fetched 20 years ago, but it is today supported by hundreds of serious peer-reviewed publications. I think of one of my patients, a 62-year-old man I'll call Robert, who I followed for several years for moderate hypertension and mildly elevated LDL. He was resistant to statins and wanted to manage his situation through diet and lifestyle changes first. We built a nutritional plan together, and flaxseed had a central place in it. After 6 months, his LDL had decreased measurably, his blood pressure was more consistently stable, and his primary care doctor was able to space out his monitoring appointments. I'm not saying flaxseed did everything on its own. He had also improved his overall diet, started daily walking, but flaxseed was a cornerstone of that strategy, and the results spoke clearly. I also think of a 57-year-old woman I'll call Carol, postmenopausal for a few years, whose lipid profile had deteriorated after menopause, a very common situation tied to the decline in estrogen. We introduced ground flaxseed into her daily diet, particularly for its lignans, which have a chemical structure similar to phytoestrogens and can have a modulating effect in that hormonal context. After several months, her lipid panel showed encouraging improvement. Again, not a miracle, but a real, measurable impact on her vascular health. These stories are representative of what I observe regularly in clinical practice. Not that flaxseed replaces anything, but that it integrates effectively into a comprehensive approach to cardiovascular prevention. And that is exactly the message I want to convey to you. The health of your arteries is not a destiny. It is not entirely written in your DNA. It is built, protected, and maintained day after day by the choices you make at your table, in your kitchen, in the grocery store. When you put a tablespoon of ground flaxseed in your oatmeal tomorrow morning, you may not feel anything spectacular happening. But inside your arteries, something is actually taking place. The soluble fiber is doing its work in your intestine. The omega-3s are participating in the modulation of inflammation in your vessels. The lignans, transformed by your microbiome, are exerting their antioxidant effects on the endothelium. That work is invisible, silent, but it is real. And over weeks, months, and years, that silent work translates into arteries in better condition, more stable blood pressure, and meaningfully reduced cardiovascular risk. That is what prevention looks like in practice. It's not glamorous, it's not a spectacular surgery or a revolutionary molecule that costs a fortune. It's a seed, a small, brown seed, available in virtually every grocery store across America. Inexpensive, scientifically documented, sitting quietly on the shelf while people walk right past it without a second glance. I'm inviting you today to take a second look, to understand it, to give it a genuine chance in your daily life, of course in coordination with your doctor and within the context of a well-balanced diet. Because the small daily decisions, the ones you make in your kitchen, on your plate, at the supermarket, hold an immense power over the trajectory of your health across time. What I hope you take away from this video is this fundamental idea. Your arteries respond to what you eat. They inflame when you mistreat them, and they protect themselves when you nourish them intelligently. Flaxseed is one of the most powerful, most accessible, and most thoroughly documented tools available to nourish your cardiovascular system intelligently. It is not the only solution, but it is a real one, backed by science and within everyone's reach. We will continue exploring together other foods, other habits, other nutritional strategies that can genuinely transform your cardiovascular health. Every video on this channel is built with the same rigor, the same honesty, and the same respect for your intelligence and your desire to learn. If you haven't subscribed yet, now is the moment. And if you found this information valuable, please share it with someone you care about, because cardiovascular prevention doesn't only concern hospital patients. It concerns your neighbor, your parent, your friend who thinks their slightly elevated blood pressure isn't a problem yet. Maybe this video will be the thing that changes something for them. Take care of your heart. It works for you every single second of your life. The very least we can do is work a little for it too,